Hello, hello, Sister Queens. Hello, hello. Thank you again for joining us for another episode of Let's Talk. All right, we're going to have big fun tonight. And of course, we're going to have Dr. Mia Cowan with us. So we are so excited. So before we have Dr. Mia on, I want to go over a little bit of housekeeping. So first of all, don't forget on April 27th, we'll be taking our Nashville trip. It'll be our party bus trip, and we're so excited. So don't forget. So if you hadn't already paid, please go ahead and do that. All the information to make your payments is online, and we'll talk about it again at the end. And one other thing, I'm sorry, I'm getting a little bit of an echo. Okay, and one other thing, I'm sorry, guys. Ooh. Okay. So other thing that I'm actually excited about it is our entire month series of Women's Empowerment Month. And so after Dr. Mia, we'll be having four other guests that will be joining us as well. So in the meantime, without further ado, let me introduce you to the amazing Dr. Mia Cowan. Today, it is my distinct honor to introduce to you a true pioneer in the realm of healthcare, none other than Dr. Mia Cowan. Dr. Cowan is a trailblazing force in the field of healthcare, renowned for her dedication to transforming lives through personalized wellness and preventive care. With a steadfast commitment to improving healthcare outcomes, Dr. Cowan has established herself as a leading authority in integrative medicine and women's health. As the founder and CEO of the premier healthcare practice Me Bella Wellness Center, Dr. Cowan has revolutionized the patient experience, offering comprehensive services that prioritizes women's well-being. Her approach combines cutting-edge medical expertise with a compassionate understanding of each individual's unique needs, empowering patients to achieve optimal health and vitality. Dr. Cowan's impact extends far beyond the walls of her practice. A sought-after speaker, educator, and media contributor, she shares her wealth of knowledge with audiences worldwide, advocating for proactive healthcare strategies and empowering individuals to take full control of their health journeys. Join us, Sister Queens, in extending a warm welcome to Dr. Mia Cowan as she joins Let's Talk. Hello, Dr. Cowan. Hello. And thank
Hello,
you again
girl.
so very much for joining us for this episode of Let's Talk. Just to make sure, can you hear me good, Doc?
I hear you very well. Can you hear me?
Okay, good. All right. So we're going to get right down to it. Ladies, I know you have been so excited to have Dr. Cowan to join us. And I
You
keep
call
getting
me
all
Dr.
these
Mia, girl.
inboxes on, oh, Dr. Cowan's going to be on. Dr. Cowan's going to be on. I have so many questions for her. And I'm so excited to have her. Hey, everybody. Hey. Hey. Send some hearts and some thumbs up for Dr. Cowan, letting her know you see her. And we're so glad to have her. Tell her hello, hello, hello. Thank you, ladies. Hey, Dr. Cowan, you see all the love you're getting?
Yes, girl. You call me Dr. Mia. Don't
Well, Doc, actually, I call you Mia. Hey, the best doctor in the
the
whole
whole
wide
wide
world.
world.
Whole wide world. She is, guys. I mean, really, I'm not just saying that because she's my friend, but she really is one of the most amazing gynecologists in the entire world. So we're going to get into how she saved me shortly. But Dr. Calvin, again, thank you so very much for joining us. And we're going to get right to the questions. Oh, somebody else trying to say they're your favorite patient. I don't know who that is, but you need to let them know they're not. Okay, Dr. Cowan. First of all, can you tell us a little bit about yourself and your journey to becoming a gynecologist?
I shall, I shall. Well, I guess it kind of started with my mom. She was a nurse, and so I used to go on like hospital visits with her when she would do home health care. So sometimes she would
Mm-hmm.
do extra stuff for her patients, like take them something, and she would bring us. And so I was like, oh, I really like this. I like the idea of her taking care of somebody. I saw that she was helping them, and I was like, Mom, I think when I grow up, I want to be a nurse like you. And she was like, oh, no, 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 no. She was like, you're smart, you're good in math and science. I really think you should be a doctor, Mia. So that was like, I don't know, I guess maybe like seventh grade. And from then on, I was just like, I'm going to be a doctor because I knew I liked what she was doing. And I liked the fact that she pushed me to even do more.
I love that, Dr. Cowan.
Mhm.
And how long was your mother a nurse?
For 40 years.
Oh, wow.
Yes,
40 years.
40
So that
years.
was your role model right there. You know, right then you wanted to be in the healthcare industry.
Yes, I did. I did.
Absolutely. Okay, Doc, can you discuss? We're going to get right down to the meat of it.
Okay,
Can
let's
you
go.
discuss the importance? Because even though a lot of us know that we're supposed to have those regular screenings, such as pap smears and mammograms, can you explain to us the importance of doing that, when we should do it, and that that's just something that we as women really need to make sure we do?
Definitely. Thank you. That's a great question. Because I've been fussing at a few of my patients lately because they haven't been going. And after COVID, they kind of stopped going. They kind of stopped going just because they got out of the habit. So they come in and I'm like, so have you had your mammogram? And they're like, no. I'm like, well, when was your last mammogram? And sometimes it's been 2 years, sometimes it's been 4 years. And these are women well over 40. So my recommendation for women is that by the age of 35 to get at least one baseline mammogram. And if everything looks good, they'll probably tell you you can wait until you're 40. At 40, you should be having a mammogram every single year. And the importance of that is that it's the difference between having a stage one breast cancer with like over a 90% survival rate at 5 years to a stage four cancer that's like less than 20% survival rate over 5 years. So we want to make sure that we are finding breast cancer as early as possible because the outcomes are going to be so much better.
Absolutely, Dr. Cowan. I totally agree with you, and I'm 100%. Now, let me ask you this. For those of us that have had hysterectomies, what is the importance of a pap smear since we don't really have anything down there anymore? What's the importance of a pap smear for us, for
Very
people like
good.
me?
So it's two different things. So every woman should have an annual every single year starting definitely by the age of 21. I say a gynecology annual, even starting as early as ages 13 to 15, to start getting your girls used to coming to the gynecologist. Even though we're not going to do an exam, we're not going to put a speculum in. We start the conversation, we start educating, we make sure their cycles are normal. We make sure we talk about contraception, we make sure we talk about prevention of sexually transmitted infections, all those things. But pap smears start at 21. So an annual exam includes a few things. You should have an annual exam with your gynecologist once a year up to the age of 65. Then it can be every 2 years. In that annual exam, we do a breast exam. We listen to heart and lungs. We get vital signs. I always feel around the neck. I do a breast exam. I feel the abdomen. And then we also put a speculum in. If you have a cervix, when we put the speculum in, a lot of times we will take a sample of the cervix, which is the actual pap smear. If you don't have a cervix any longer, or you're over the age of 65, we may put the speculum in to look at the vagina, but we're not actually taking a sample to send off for cervical cells if you don't
Okay.
have a cervix. Okay. And
Got
every
it.
time I put that speculum in, even if you have a uterus, I may not always be doing a pap smear. So it's so good to communicate with your provider so you know exactly what's being done, which isn't a problem at Bella, because we let people know what we're doing, but everybody
Absolutely.
doesn't. So we say,
Mm-hmm.
if I'm not going to do a pap this year, I said, we don't need to do a pap this year because you had a normal pap last year and your HPV was negative. So I'm not going to send cells, but we still need to do that exam. We still need to feel inside, feel the ovaries, make sure everything feels normal on the inside, everything looks normal on the inside. So whether you have a uterus or not, you should be having an annual exam. We just may not have to send pap smear cells if you don't have a cervix, or if it's not time for us to send cells again, because the recommendation is my recommendation is every 1 to 3 years. They say every 1 to 5. I don't do that at all. I,
Mm-hmm.
I do every other year. If you had an HPV negative and you want to go an extra year without me sending cells, but you still need the exam, you still need your
Absolutely.
annual.
Absolutely. And I like when I went and you guys told me that it was still nice and pink. So
And healthy, such a healthy vagina.
so my vagina was nice and healthy. So
Very
thank
healthy, and it takes work to do that. And then you know,
absolutely.
as you age and mature, it changes color because of the change in hormones, and so it becomes more pale, thin. It can cause dryness, discomfort, more urinary tract infections, pain with intercourse. But when it's healthy and we're treating it and using something topically on the tissue a couple of times a week, then it's going to be healthy and pink and lubricated and sensitive and orgasmic, and it's going
Mm-hmm.
to maintain good function. And then it's going to decrease your chance too of getting urinary tract infections and leaking urine with coughing, sneezing, jumping, laughing. And it's also going to help with urgency and frequency. So keeping that vaginal tissue healthy and strong is important for not just sexual function, but also your bladder and also just your pelvic floor in general.
Absolutely, absolutely. Now, the same for mammograms, Doc, and you kind of addressed that we need to make sure we do that every single year, correct?
Every year,
Every
and even
year.
when I'm 65, if I have to pay an extra $200 to get a mammogram, I'll do that because I want early detection. Because I have seen women who had a mammogram and then they feel something, or and something feels abnormal, but they just had a mammogram 3 months ago and they're
Mm-hmm.
feeling something. So it's not just important to have a mammogram, but also to check your breasts, to do a monthly breast self exam. You should do that
Okay.
laying flat in the bed. And when you're not having cycles anymore, I say just pick a payday out the month, or pick a day
Mm-hmm.
out of the month. And every month you're gonna, when you wake up that morning while you're laying flat in bed, you're gonna check each breast under the arms, around the neck. And then you're also going to do that same thing standing in the shower. So self breast exams are just as important to me as mammograms. You get that mammogram once a year, you check your breast in between time, and you go for your annual and let your physician do a breast exam as well.
Absolutely. I totally agree in checking my own breast because, like you said, there have been so many people that have found knots or nodules in their breast tissue when they're doing it themselves right after they've had a mammogram.
That's
So
right.
it's very important, very, very. And you need to
Very
let your doctors know immediately. Don't ignore it. If it doesn't feel
right.
right, make sure you
Come
tell
to
your
the doctor,
doctor.
let us examine. We're going to order the
Exactly.
mammogram, order an ultrasound. We have a great relationship with the wonderful radiology center here in Birmingham,
Yes, you
Alabama.
do.
And she gives your results the same day. Her ticks are amazing. It's not
Yes,
painful. And and again, she gives you your results the same day. And she also does the ultrasound if you need a workup, because that causes so much anxiety for women when
it
you go to
does.
get a mammogram and then they call you a week later and say, oh, you need an ultrasound. And so you're thinking something is wrong. Well, she just does it right then, lets you know exactly what's going on. If a biopsy or anything is needed, you know before you leave that office what's going on.
Absolutely. Absolutely. And I love, it's okay if we say Camille, their
Yeah,
name, right?
Camilla, honey, Dr. Tataria, we love her.
Right. They
She
are
has saved
so
so many
good.
of
And
my
again,
patients'
like Dr.
lives.
Mia stated, when you go, they let you know your results right then. And if there's an issue, they talk to you and let you know what you need to do. So I would definitely, recommend Camellia. You're so comfortable when you go there, and
The
it's a nice
road.
environment. It's really wonderful. And I totally believe in selecting doctors that are going to advocate for you, and
That's right.
doctors that are going to fight for your health. Of
That's
course, you
right.
have to be your biggest advocate because you got to let the doctors know what's going on, but always pick someone that's advocating for you. And if they're not, then you need to find someone else.
Another doctor. That's right.
Absolutely, you need
That's
to
right.
find another doctor. I also too believe in, I that's just me now. I believe in, if they look like me, they're going to be more concerned about me. Not that others aren't, but that's just how I feel. I
Mhm.
want somebody that can understand me culturally and what might be going on with my body. So I love doctors, that look like me when I can
And
get them.
care about me and all of
Exactly,
their patients.
exactly,
It's
and
not just
absolutely
Black
care
women
about
that
their
want
patient.
Black doctors. Like, studies show that Black doctors really do take better care of their patients, and our patients have better outcomes because we listen, we respect people, we understand that, there may be a difference in educational level. So we know how to break
Exactly,
it down to everybody, to Auntie Nim, the grandmama Nim. We can relate. And so it is a big
absolutely.
difference. So it's not just Black women that seek out Black physicians. It's all people that seek out Black physicians because they know we worked harder. We had to go through way more and we had to do a whole lot more to be here. And we are here because we want to be here and we want to take care of our community. It's not
Absolutely.
about a dollar.
And one other thing too, Doc, what I was going to say about that. And one other thing when it comes to that, can you tell us a little bit about the disproportion of, like when it
The health
comes to African
disparities.
or black and brown people when
Oh,
it comes to
yeah.
healthcare?
Yes, and I've seen it. I've seen it a lot here, especially in Birmingham, Alabama. I trained in Milwaukee, Wisconsin, and I guess I didn't have the opportunity to see as much as I've been able to see here, practicing at Cooper Green Hospital, practicing in my own practice for the last 13 years. But we don't get the same treatment as everybody else, and it's
Exactly.
very unfortunate. Like, I have sent a lot of my patients and have actually saved their lives when they were complaining about heart pains that they had discussed with their primary care doctor, and they were just kind of written off. And then I send them to my friend who's a cardiologist, and they're going back for surgery the next day for open heart surgery, and they had been written off. So we don't always get the same care. We don't have health
Absolutely,
disparities
Doc.
in America just because Black people don't go to the doctor. We have health disparities because we don't always get the same care. We don't get the same level of care, and we don't get treated the same way. For the
Absolutely.
number of women I've seen that have had a hysterectomy and don't know why they have a hysterectomy, or the women who've sought me out because somebody told them that was their only option, but they wanted another option. The women who come in seeing a doctor every day and they have high blood pressure that's uncontrolled. And I ask them, are they seeing their doctor? They're seeing their doctor. Their doctor sees that their blood pressures is high, but they don't even care enough to refer them to a cardiologist to save their lives, because you cannot walk around
Absolutely.
with 160 over 105 blood pressure and your doctor tell you they just can't get it under control. Well, if they can't get it under control, you need to go to a cardiologist or somebody else who can. And
Absolutely.
when a doctor cares, they will figure out how to get it under control. And if I can't do it, I can send you to someone who can. But that's just caring
Absolutely.
for your patients, and I care
And
for
that's
all.
what I love so much about you, Doc. You're going to make sure it's taken care of. And if you can't do it, you're going to send us somewhere where it can be done.
Yeah, and
And
that's
I love
every
that.
patient that walks through my office, whether they are Black, whether they're white. They can have a Trump hat on their head.
Mm-hmm.
I don't care. Everybody's going to get great care because that's my duty. That's my obligation to take great care of every patient that walks through my door, regardless of color, sexual preference, socioeconomic status. I'm supposed to take care of each person like it's my mother that walks through that door.
Absolutely, girl. That's it. You said that.
Hmm.
And I even asked my doctors, what would you do if it was one of your family members? And
Right.
that's the same kind of treatment that I want. So, and I know I get that from you. So I don't have to worry
Hmm.
about that. So let me answer one of the questions. They said, Dr. Mia, is it advised to continue well, we talked about that after a total hysterectomy.
Yes, so you need to do pelvic exams, but you may not need to do pap smears. Usually, the only
Right.
time we do a pap smear after hysterectomy is if you had the hysterectomy for abnormal paps or for cervical cancer, or if you have a
Hmm.
history of endometrial cancer. But if you don't, if you have a history of normal paps before your actual hysterectomy, we don't continue to do pap smears where we send cells to be tested, but we do need to continue to do an exam at least every 2 years. But I recommend if you're under 65, just have your annuals every single year so we can recognize any problems. And it's not just for recognizing problems and just prevention and screenings. When you're in your 40s and 50s and 60s and 70s, your body starts to change. And with those changes, you want understanding and you want to know options to make sure you can maintain good, healthy sexual function and just total wellness and to feel good and continue with a great quality of life.
Absolutely, absolutely. I like that, Doc. Okay, we're going to move on to our next question. And everyone, don't forget to put your questions down, please. And we'll be asking Dr. Mia because that's what she here for. Ask Dr. Mia. Okay, one question we do have. Do you have a cardiologist that you could recommend, Doc?
Huh? A
A
card? Oh yes,
cardiologist?
Annabella Simon Lee and Tim Lee at Alabama Cardiology. So they are a husband-wife couple, and
Okay.
she is a cardiologist, and he is a interventional cardiologist, and they are absolutely amazing. And they are
Okay,
people
say
of
that name one
color.
more time, Doc, and we're going to put it in the
Annabella
chat.
Simon Lee. Annabella Simon Lee at Alabama Cardiology, and her husband is Tim Lee, Lee.
Okay.
Yep. So if you look up Tim Lee,
Annabelle,
both of them
Simon
will
Lee,
come
and
up.
Tim
Yep.
Lee.
Look up Tim Lee, and both of them will come up. So
Okay.
I highly recommend them. They take great care of all of their patients, and they have all kinds of patients too. But their patients have great outcomes because they really do care and they listen and they take the time to take great care of everyone. And night
Great.
sweats. Somebody said night sweats.
Yeah, I know. We're going to get to that. Okay, and here's the main question that I've been getting. Like, please don't forget to ask her this. What advice do you have for women suffering from hot flashes, night sweats, brain fog, and mood swings, those menopausal or perimenopausal symptoms? Here we go,
Okay.
Doc. This is the
Let's
one.
go, honey. Y'all know I love to talk about them hormones. But
Let's talk about the
so
perim.
as we age and mature, the first thing that happens, I guess the first thing that really happens is your progesterone starts to decrease. But so what? You don't really have a lot of symptoms with that. But
Right.
secondly, it's your testosterone. When your testosterone starts to decline, yes, that is the male hormone. I call it the forgotten female hormone, and I call it the anti-aging hormone. But when that
Right.
starts to decline, and for some women that can be in their 20s, for some women that can be in their 30s, but usually it's the late 30s, early 40s where women notice these symptoms. So then they start to notice that they're waking up in the middle of the night. They're having night sweats and they're having to get up and change their clothes. They notice that their libido has decreased significantly and they pretend like they're asleep when their husband walks in the room. They have to work really, really hard to have the big O.
Right.
They're really tired all the time. They notice that they can't remember and focus as well. They have what we call mind fog. And then the mood swings, like just severe irritability, where you know that what you are thinking is like wrong and ugly. And you know that what you want to say, you should not say, but you just cannot control it. That irritability, or if you already had anxiety, the anxiety can worsen. If you already had depression, that can worsen. If you already had, bipolar disorder, you'll notice that those mood symptoms continue to worsen, even if you're still taking your medicine. So those are signs and symptoms of low testosterone. And as testosterone
Mm-hmm.
declines, you can just replace it and fix it. But what ends up happening is that you go to the doctor and you tell them you can't sleep. They give you some medicine
Mm-hmm.
to help you sleep. Then you
Sure
start
do.
gaining weight. So they give you a pill to help with your diet and to help with your appetite. Then you depressed. So they got to give you a pill because you depressed. You weren't ever on a pill and you were depressed. Then
Mm-hmm.
they got to give you some extra vitamins because you're so tired all the time. And then when your libido down, they just say they don't really care about that because they don't really care about sexual
Mm-hmm.
function for women. So they just like, whatever, that's just a part of life. Just, pretend like you like it or act like you want to do it, or that's just normal for an aging woman. And then you start to notice like the vaginal dryness, the decreased arousal, where you have to work so hard and you still may not have the big O. So those are all signs and symptoms that your testosterone levels are starting to decline. But the good news is that you don't have to live like that because we
You
have ways
sure don't.
testosterone that not only help with those symptoms and improve your quality of life, but also testosterone is breast protective. It
Mm-hmm.
decreases the risk of breast cancer, decreases the risk of breast cancer recurrence in women who've had breast cancer. They can actually use testosterone in a special
Mm-hmm.
form, but they can still treat their symptoms. It also protects the heart. So if you think about it, when women get heart disease, that's when they go through menopause. Most women are over 50 when they don't have any more estrogen or testosterone. So ladies, that's also why it's important to get your cardiac screenings, especially once you have hit menopause. I rather you
Absolutely.
do it when you're perimenopausal. So like I'm 48 now, I'll be 49 this year, and I'm probably getting close to that point. So I need to get my cardiac workup to see where I am baseline and then continue to get those on a regular basis, which includes an echo, a EKG, and a stress test. And you can just go to Dr. Annabella Simon Lee them and get that done. And then it also protects the bones because as you age, the bones. So you see all these women in their 50s walking around with a brace on because they fractured a foot or fractured an ankle or hurt something and barely fell or just stepped off the curb wrong. That's bone loss. And then the other thing is it protects the brain. So it helps
Yeah,
decrease
absolutely.
dementia.
It does. And it also helps with that brain fog.
Oh
I
my
definitely
God,
agree. And we're
yes.
going to let you know what they can do to get rid of those night sweats and mood swings and hot flashes. Because, baby, I was one of those women until I went to Dr. Mia. And since I have been going to her, and she's not paying me to say this, it's just the truth. Since I have been going to her, I do not have night sweats. I do not have mood swings. The big O is owing.
Oh, Wayne. Oh, hi, Wayne.
I have a happy, happy husband. It's totally worth it. And we're going to let her tell you exactly what that is.
And
Okay, but let's get to this. Go ahead, Doc. I'm sorry.
I see on here where somebody said I had the T shot and it didn't
Yeah,
work.
let me go. That's what
So
I was
I'm
going to
not
say. They
talking.
had the T shot and it didn't work. What's a T shot, Doc?
So this is not, we're talking about plant-based bioidentical hormone pellets. And that's why
Mm-hmm.
the yam works because hormone pellets are made from the yam. So somebody in there said that they were told to eat sweet potatoes and that may help with their
Yeah, let's
night
go to
sweat.
that one. That was
Yeah,
another one. I was told
yeah.
that
So
sweet
so
potatoes
actually
provide natural estrogen to help with night sweat. It seems to work for me. Are there any other foods or natural sources that can help? What do you say about that, Doc?
so what I say is, as far the pellets are made from a yam, not really the sweet potato, and the sweet potato is actually very different from a yam. It's a different, it's a whole different vegetable. But there are natural sources, and some people like soy. But my problem with soy in America is that soy is in everything, so we are over soyed, and soy does turn into an estrogen. But the problem is that we have so much of it, so I don't really recommend women drink soy milk because you don't know how much estrogen exposure you're having, especially when you're still premenopausal and you have fibroids. It stimulates fibroids because it's more estrogen. But there are, so that would be and then the other things that you can do to help with your transition into menopause is exercise regularly, making sure you
Mm-hmm.
do plenty of strength training, maintain a healthy weight, getting on a healthy sleep diet, meaning you go to sleep at the same time every day. You have, a very healthy sleep environment. So there are some natural things that you can do. And for some women, those things work. But for the ladies who see me, they tend to have pretty severe and significant symptoms. And so doing, foods may not completely get rid of their symptoms because a lot of patients that see me are very healthy granola patients that take all their supplements and they see
Mm-hmm.
doctors and all of that, but they still need some help with balancing their hormones. And a T shot is not plant-based bioidentical hormone therapy. That is synthetic testosterone. That's a shot that men get, and sometimes they give it to women. But what I'm talking about again is plant-based bioidentical testosterone pellets. And those are
Right.
made from the yam. They look just like the hormones your ovaries used to produce. And if managed by a hormone specialist and your levels are monitored and you're dosed appropriately, it's going to improve your quality of life and your overall health.
Okay, good. And I'm glad you brought up the pellet. Okay, so you've gone over that a little bit about what it is. But let's kind of start back because we were answering the question. Let's start from the beginning on the hormone pellet. Tell them what it is
Okay.
actually.
So again, hormone pellet therapy is plant-based bioidentical hormone therapy. So there are
Mm-hmm.
two major hormones that affect the symptoms associated with perimenopause and menopause. The first hormone is testosterone, and that's the one we just talked about that can cause night sweats, problems with sleep, decreased sex drive, decreased orgasms, mood
Mm-hmm.
changes, mind fog, joint pain, belly fat,
Mm-hmm.
fatigue, and weight gain. And then the
Absolutely.
second one is estrogen. Estrogen, so testosterone, anybody can take testosterone. So even
Okay.
if you have a history of breast cancer, you have a strong family history of breast cancer, testosterone is breast protective. It's just that when I do the testosterone for women who've had breast cancer, I put a medication in it to keep it from turning into estrogen so they can do the testosterone pellet with the nastrozole. So that's
Okay,
one thing. Then
good.
the other part of the pellet that some women need is the estrogen. Estrogen,
Mhm.
when that starts to get low, that's when you notice the hot flashes during the daytime. The
Yes.
Yes, the hair shedding, the hair thinning. It can be your eyebrows falling out, your lashes falling out, your skin
Mhm.
gets thinner, you get more wrinkles, you get the vaginal dryness. It can still affect your mood. It can definitely cause, more heart disease as your estrogen levels decline, and it also causes more bone loss as your estrogen levels decline. So the two main
Okay.
hormones that we replace, testosterone and estrogen, those two hormones can be in a pellet. And then we also, if you have a uterus and you take estrogen, you have to take progesterone. If you have a history of breast cancer or blood clots, stroke, or major heart disease, we don't give you estrogen at all. But you can
Okay.
still take testosterone safely and get rid of most of the symptoms associated with menopause and perimenopause.
Okay, yeah, because that answered this Facebook user question. I was told that hormones won't work, because of breast cancer, but you just addressed that. So
Yeah.
if you have that issue, they just do not receive the estrogen, correct?
Right, or progesterone, but you can safely do testosterone with a nastrozole in a pellet form. And our studies show that it decreases the risk of recurrence of breast cancer as well as decreasing the risk of ever having breast cancer.
Okay. And tell them how easy it is to get the pellet and how long it. Well, let me do say this before she gets into that. When I got mine, it was wonderful. And what I love about Dr. Mia, she starts you off really, really low. So it's not like you got to worry about going in. She's going to give you this a whole lot of medicine. You're going to have all these side effects and whatever. I know everybody's different, but she starts you off really, really low and she gradually builds to get you to that comfort level. So tell them a little bit about that, Doc, how it's put in and what how you start and what you do.
Okay, so first we start with a consultation. So I
Mm-hmm.
find out what's going on, what problems you're having, what symptoms you're having. I need to know all about your medical history, your surgical history, your
Mm-hmm.
family history, what symptoms are bothering you, what medications you're taking, all of those things. So once I get all that information, I get some blood work. And with the blood work, that tells me exactly where you are. When you're in true menopause, we say that you're postmenopausal once you've gone a whole year without a cycle. If you have had a hysterectomy, we go by your blood counts. So we look at FSH or follicle stimulating hormone. When that starts to increase significantly, we know you're transitioning into menopause and your estrogen levels plummet as well as your testosterone. So
Okay.
we go by that if you've had a hysterectomy, so we can't go by your cycles. If you have not had a hysterectomy and you stop having your cycles for a year, we still go by your numbers and your labs to decide which hormones need to be replaced at that time. And then we also base it on your symptoms. I base the dosing on your weight. I base the dosing on your BMI. I base the dosing on your history of activity, your activity now, and your lab values and your age. And then
Mm-hmm.
once I figure all that out, the way I place the pellet, once I've gotten all your blood work back, and the blood work is not just hormones. So we're also ruling out other things that can cause these symptoms as well, and making sure that your liver is good enough to be able to tolerate hormones. So you want to, check your kidney function, check your liver function, check your thyroid, because abnormal thyroid can cause a lot of these symptoms as well. So once we figured all that out, I numb you up and it goes kind of in your hip.
Mm-hmm.
I numb you. I let that sit for anywhere from 5 to 10 minutes, and then I make a teeny little incision, put your pellet dosing in based on my 10 years of experience of dosing pellets, and being one of the only gynecologists in Birmingham who does it and does it as well. And I decide what your dosing should be, and then once I have that dosing, which like Stephanie said, the first dose I always dose you lower, and then I get your blood work at 6 weeks. When I place the pellets, you're not uncomfortable. I put two
At
steri
all.
strips and a bandage on for,
Mm-hmm.
a few days. You may be sore. You don't want to hit up against it. After 3 or 4 days, you go back to your normal activities. But initially, I don't want you doing squats. I don't want you to go horseback riding, and I don't want you to submerge in water. After 3 or 4 days, you go back to your normal activities and you take the bandages off. We get your blood work in 6 weeks. So I see how you respond. Because that's the beauty behind pellets is it's
Mm-hmm.
individualized, it's customized. It can be somebody that's the same age, the same height, the same weight, that did the same stuff that I do now. And their dosing can be 150, whereas mine can be 262.5.
Absolutely.
So again, we're conservative with the first dose. Get your blood work, see how you respond. If we need to add more, we add it. And most women are going to need pellets every 3 to 4 months.
Absolutely. And that's what I love. So very, very thorough. You have blood work. She's always checking. I mean, it's up to us to go to have that blood work done, but she's very, very thorough. She's going to make sure that your entire body is working properly, even after you start getting pellets, through your blood work, through checking your numbers. And so you don't have to worry about any of that. And if there is any discomfort or if there is anything bothering you, or if it's too high or, I feel like, hey, I'm gaining or my hair is starting to shed or whatever.
Right.
You need to make sure you let Dr. Mia know those things so
Mm-hmm.
that she can adjust it. So,
That's right.
any problems you have, and I can just, again, I'm just speaking for myself. Hadn't had any issues, and if I did need a boost, oh, tell them also, Doc, if you need a boost.
Right. So when we do that first pellet, remember to be conservative and to make sure you don't have negative side effects like
Mm-hmm.
increased facial hair or thinning of your hair, deepening of your
Mm-hmm.
voice. I have to make sure I don't give you too much testosterone.
Right.
So I give you less than I expect, get the 6 weeks blood work, see how you respond. And then if it wasn't quite enough, and I go based on your numbers as well as your symptoms. So if you still having night sweats, you didn't get enough testosterone. If
Right.
you still having hot flashes, you didn't get enough estrogen. If you're sleeping great, feeling great, your sex drive is good, your energy is good, you're having the best intimacy that you've had in a long time, your mood is better, everybody's asking you what's wrong because you feel so good. We know you already got enough testosterone. If you're not
Mm-hmm.
having the vaginal dryness and everything is great as far as the hot flashes go, and the combination with the testosterone and estrogen, all of your symptoms are gone, that's a good dose for you. And that number
Mm-hmm.
can be for testosterone, that number can be 400 for me, but for somebody else, that number is 250 and they feel absolutely amazing. So it usually
Absolutely.
takes to the second pellet for us to really know exactly what you need, but that's the safe way to do it to decrease any chance of you having any problems.
And I totally agree because when I had the first one, it didn't, I didn't feel any different. So I went back to Dr. Mia and I told her, I'm like, I'm not feeling any different. So I got another one and then it took about maybe 2 to 3 weeks and I'm like, okay, I
Good.
can. And I really went to her because of the night sweats. They were they were horrible. When I say I
Yes,
had
that's a
horrible night sweats, they
miserable
were horrible.
feeling.
And she had already told me, like, Stephanie, you really need to try this. I'm telling you, you really need to try this. But I was like, nah, no, I'm good. I'm good. I don't really want to do that. I'm good. Baby, those night sweats start hitting differently. So I
Yes.
had to go ahead and do it, and it was the best decision I could have ever made.
Mm-hmm.
Ever, ever, ever. I mean, I just don't have them anymore. So if you do need that extra boost, she will give it to you. She's going to make sure your numbers and everything okay. No pain. Again, I'm just speaking for myself. I've had no pain, no problems, no issues, no anything. I would recommend her to anyone because it just literally, and I tell her, it just literally saved my life because I was
Yeah.
miserable.
Yeah,
I
and
was
I mean,
miserable.
and mentally for some people, like everybody's different. So some people are like, well, I don't need all of that. And that is a blessing. Like if you don't
Mm-hmm.
have severe menopausal symptoms that affect your quality of life and your relationships and your professional career, that is amazing. That's awesome. And be grateful. But for those of us
Mm-hmm.
who do have different experiences, the good news is there are options out there to really help. And somebody asked, what is a treatment for osteoporosis? My women who come in with osteopenia or osteoporosis, once they've been on the hormone pellets for 1 to 2 years, we can see an improvement in their bone densities because it
Good.
helps to rebuild bone mass. So that's one of the great health benefits is that it decreases bone loss. So testosterone, estrogen, and progesterone all do that. And remember, if you can't do estrogen, you can still use the testosterone, and that will help with your bone mass.
Okay, one quick question, Doc. What would you recommend, or would you recommend probiotics for vaginal health?
Yeah, there are actually some specific probiotics out there that work really well for vaginal health. There's actually one prescription one that just came out, and then there's one we use with a company called Claire V. But here's the other thing. a lot of times vaginal health is based on your hormones. So one
Mm-hmm.
of the treatments that I have for my ladies, and when my ladies are like 40 now, or they're on birth control, because contraception suppresses the estrogen in the vaginal tissue and can cause those aging symptoms earlier, I have them
Mm-hmm.
to start treating the vaginal tissue with either an insert that has hyaluronic acid, or an insert that has vaginal estrogen. And
Okay.
those inserts are going to help with your vaginal health. So you won't feel like you need the probiotic. A lot of times you feel like you need a probiotic, one, because you're using the wrong soap. So
Okay.
Dove White Bar Sensitive Skin, or the original, and it has to be the bar. That is the
Okay.
soap, as a gynecologist of many years, that keeps patients from coming in over and over complaining of bacteria vaginosis and yeast. Once you change your soap, it makes a huge difference. And the other thing that helps is treating that vaginal tissue topically. So with the hyaluronic acid or the vaginal estrogen or the vaginal DHEA, I recommend doing something twice a week at night, right before bedtime, to maintain healthy vaginal tissue. And you probably won't be looking for a probiotic if you do those things. Use the right soap, and then use topical treatments to maintain healthy, vibrant, orgasmic, sensitive vaginal tissue.
And I will say, just with me, I had already been using the soap, but Doc told me about that as well. But as far as the pellet itself, because I did suffer from dryness
Mhm.
before I got the pellet, and afterwards I don't.
Yeah, the
I mean, I just
estrogen in the
literally
pellet
have
does
none.
help.
I mean, it really, really does help. We had a patient, I mean, a user to ask, is it covered through Blue Cross Blue Shield?
No, ma'am. Unfortunately, insurance does not care about the happiness and the sexual health of peri and postmenopausal women. So it is not covered under insurance. It is an investment. So to do the pellets, you invest some time and some money, but the value that you get from it is usually
Well
indescribable.
worth it. It's
Yeah.
absolutely well worth it. I'm not trying to count anybody's coins, but I
Mm-mm.
will say it is well worth it. I mean,
Mhm.
it's just well worth it.
And
I'm going to do it.
but now if you have an HSA account, a health spending account, or a flex spending account, a health savings account, or a health flex spending account, a lot of times they will allow you to use that for the pellets. But we don't bill it under insurance. And we do have some great and some very convenient and some good ways to pay for it that makes it affordable. So we have subscription plans. Some people just pay for it as they go, and then we have membership program where you can get discounts on other services. So we make it where it's something that everybody can do regardless of
Absolutely.
income. If it's something you want to invest in and you feel like it's important, we have made it where you can figure out a way to afford it.
And it's so important. It is just so important. There's just no way I would not do it, because I
Hmm.
can even tell, and once you start getting the pellet, you will. You can tell when it's time for you to start getting it again,
Yeah.
because then you may have a little bit of irritability. Because me, I'll try to stretch it as long as I can, but then I'll start feeling a little irritable, or
Him and say,
I might
please
feel
go
just a
on down there.
smidgen hot. So then I'm like, okay, doc, I'm on my way back. I'm not comfortable. I don't feel good.
Right.
So then
Exactly.
I know it's time. So your body will most definitely tell you. So you don't have to worry about that. So again, it works for me. I can only
Yeah.
speak for myself. It is just well worth the investment. And if you're suffering anything like how I was suffering, I would advise that you do try the hormone pellet. Now we had
That
you
might
would
help.
also say I had the hormone pellet most for depression, but it helped with weight, and I definitely experienced a change in libido.
Yes.
Yes,
And it helps
that
with
was an
weight
extra for me.
indirectly. Yeah, definitely. It helps with weight indirectly because it helps you to hold on to more muscle. So you need testosterone for muscle mass. So when you have more muscle mass, your metabolism goes up. And then you stop gaining as much weight in your belly when your testosterone levels are at a good level. And then you have more energy. So you exercise more. And then you're not as anxious or irritable. So you have less emotional eating. So it's very indirect how it helps with your weight, but it makes weight management so much easier. Ever since I have been on the pellet, I have been able to maintain a healthy weight so much easier than I could before the hormones.
Okay, all right. We had the Blue Cross Blue Shield. Okay, hold on
And the
one
cost.
second. Okay, I just want to make sure I'm covering everyone's questions.
And then the other
Any
question about osteoporosis can
Yes.
So also resistance training is very good for bone mass. So that's why we
Mm-hmm.
say do the resistance training, whether that's calisthenics, Pilates, yoga, whether that's water aerobics, but doing something with some kind of resistance training is going to help with your bone mass, making sure you're getting plenty of vitamin D3 and calcium is important. And again, hormone replacement therapy does help with bone mass. And there are several medications out there, and they don't all make everybody sick. But again, the best way is prevention. So if you are doing your resistance training, balancing your hormones, those things will actually help prevent osteoporosis. If you already have it, still replacing the hormones. And sometimes you do need to just take one of the medications that don't make you personally sick, because it is important to maintain good mass so that you don't have a fracture and become immobile.
Good, good, good. That's good to know. Okay, we have a user that says, my 82-year-old mom still has hot flashes. Is that normal?
Yeah, some women have it for a long time. I've had quite a few 80-something-year-old patients that had hot flashes, and some of them have done some hormones for them because they were healthy and they didn't have any real contraindications against. But there are some non-hormonal options for treating hot flashes as well. There are some that actually, I think it's a new drug that was just that somebody just launched that helps with hot flashes, and we can use some antidepressants at a very low dose that help with hot flashes. So for women who may have had breast cancer and they can't do estrogen and they're having severe hot flashes, we do
Mm-hmm.
have some non-hormonal medications that we can use to help with hot flashes during the daytime.
Okay, and I like that, Dot, because what she's not trying to do is just push pellets. There are other options. I
Hmm.
brought that up because I just know it works so well for me, and
Right.
also I'm not one to, be consistent with taking
Cream.
pills or
Yeah.
rubbing cream behind my knees or anything. So if that works for you, that may be an option that Dr. Mia
Hmm.
can speak with you about. But for me, I knew that was not for me, and the pellet is easy. I don't have to worry about taking anything or using any creams, and I just go every 3 to 4 months, and I'm good. So
Right.
you just really have to do what's best for you and your family and your income. But it just worked better for me as far as the hormone pellet. But I would definitely advise scheduling a consultation with Dr. Mia, and we'll get to that toward the end, and she can set up an appointment to meet with you and then tell you what best works for you.
And
Okay.
that is a good point. I'm glad you said that. And I do have patients that can't do the pellet for whatever, for because it's more expensive, or
Mm-hmm.
they may not want to do the pellet and they do the hormone cream. So we have the plant-based bioidentical hormone pellet, but we also have the plant-based bioidentical hormone cream. And both
Okay.
of those can have the estrogen and the testosterone. It's just with the cream, you rub it on, it absorbs through your skin. You have to
Mm-hmm.
apply it 2 clicks in the morning, 2 clicks in the evening. And what I tell my patients is if you don't want to invest in the pellet, I would rather you do the cream than not do anything. You
Anything,
know what I
because
mean?
you will
Because you're still
suffer.
going to feel better. Exactly. And I
Absolutely,
have some
you will feel
patients who,
better.
like the cream and they don't want to do the pellet. But I don't have too many patients that did the pellet and went to the cream and were happy.
Mm-mm.
But I do have patients who do the cream and they feel so much better than not doing anything. So it's well worth it. And it's well worth them getting on a schedule and a regimen to make sure they're consistent with it and they notice an improvement.
Okay, we're going to take a couple more questions about the pellet, then we're going to move on. So we have a user in Panama City. So do you know of any doctors there that can help with the pellet, or you
No,
can
but what I
recommend that do the
tell people
pellet?
is what you can do is you can go to BioT pellets, Google that, and then you can usually put your zip code in, and you can. And if you're a woman, I just think that gynecologists work really well with pellets because if you have a problem, like you start having bleeding or having any issues like that, if you're already seeing a gynecologist, we can manage any problems that you can have. So I always say, look on the BioT website, put your zip code in, and try to find a gynecologist that actually does the hormone pellet therapy. If you're a woman, I take care of men for hormone balance and intimacy services as well because I was
Mm-hmm.
trained for men and women when I trained for women. But for women, I would say if you can find a gynecologist that does it, that would serve you well. So if problems arise, they can fix and manage those issues.
Absolutely. So what she's saying is speak to a good gynecologist in your area that does, but first of all, look on their website and then find a gynecologist that does the hormone pellets and then make an appointment with them. Correct, Doc?
Yeah, and do your research because now you can Google everybody. You can look at the
Absolutely.
reviews. You can see, see, if their patients have had a, good experience, all of those things. So yes.
Absolutely.
And a
So
lot of
main
OBGYNs don't do hormone pellet therapy. I was actually the first gynecologist in Birmingham to do pellet therapy. And now more gynecologists are starting to do it. So it's a chance, but we're still in Alabama. So this would be considered more holistic medicine. And a lot of physicians in Alabama don't believe in holistic medicine. So they may do it and may not.
Okay, right quick, Doc. We'll just a little bit, but we have a user that wants to know what's the cost of the pellet. But I would also say, when she does tell you the cost, again, she did tell you that there are ways that she can help with that. So I would not let the cost scare me because it's just so much worth it. But go ahead and let them know about the cost, Doc.
So every time you get a pellet, you pay $4.97 pretty much, unless you decide to do one of our subscription plans where
Mm-hmm.
you can pay for your pellets monthly for the year, and you can do that with 3 pellets a year or 4 pellets a year. And we also have some membership programs to make it easier and for you to get other discounts, like on our intimacy services, like the O shot and O waves, and a lot of our in our weight management, all of those things.
Absolutely. So again, I would say, I mean, it's just truly worth the investment, and she does have several ways that can help you with the payment. So it's definitely worth it. Okay, Doc, we're going to move on to the next question.
Mhm.
Okay, here's a good one. What advice do you have for women regarding sexual health and ways to maintain a healthy sex life?
Okay, so besides, your testosterone balance, because testosterone is huge for sexual enjoyment, and
Uh
for
huh.
orgasms and for maintaining a clitoris that's sensitive.
Uh huh.
Also treating the vaginal tissue. So like I said, twice a week using something on the vaginal tissue. Even when we talk about vaginal estrogen, that's not going to raise your systemic levels. It's going to work locally on the vaginal tissue. So somebody who's had a blood clot can do the vaginal estrogen. We don't want them doing systemic estrogen. But we also have, like I said, hyaluronic acid as a topical. We have a pill that's not actually estrogen that works on the receptors in the vaginal tissue. And we have something else called DHEA. So I think that's the start. Everybody should be doing that by the time you're 40. And, I have all of my older patients. It's like, I don't have that problem. I'm like, I'm doing your exam. Your vagina is not like a 25-year-old's. We age. Our skin is not like it was when we were 25. Our vaginas are not like they were at 25. However, you can treat the vaginal tissue and maintain healthy vaginal tissue. So that's first.
Mm hmm.
So hormone balance, treating the vaginal tissue, making sure you're continuing to exercise and do your Kegel exercises,
Mm
doing
hmm.
your Pilates and doing your yoga for better stretching, better flexibility, more muscle mass. That's all important. Of course, maintaining a healthy diet. Of course, you cannot maintain good sexual health if you're not healthy. So if you
Absolutely.
diseases like high blood pressure, you got to control your blood pressure. If you have diabetes, you got to make sure your hemoglobin A1C is normal, because even diabetes decreases sensitivity to the vaginal tissue. So it's going to change your sexual health. And
Mm
so
hmm.
thinking about, just being healthy. And then on top of that, we have some wonderful procedures. One of my favorites would be the O shot. So with the O
Mm
shot,
hmm.
we can actually increase your vaginal orgasms and your clitoral orgasms. And the O shot also helps with leakage of urine, with coughing, sneezing, jumping, and laughing, as well as urgency and frequency. So it also helps with the vaginal tissue, helps to regenerate vaginal tissue, helps with sensitivity, stronger, longer, more intense, more frequent orgasms, helps with tightening, because as the tissue ages and you
Mm
lose
hmm.
the tissue, you may feel like things are a little bit more lax. So it helps with the tightening. And it also helps, like I said, with the orgasms.
And again, all of that you can get. I would definitely, because those are some of the questions that some of our viewers were asking. But I would definitely say schedule a consultation with Doc, and you can go over all of that. I mean, and one thing about it, be honest when you go in, because you
Yeah.
can be totally honest with Doc. You don't have to beat around the bush. You can let her know exactly what you're going through, exactly what's happening, and and she can not only help you, but if there are some issues when it comes to your male partner as well, whether it be your husband or and you want to bring them to see Dr. Mia. She works with men and women, so or women and men. It's not
Mhm.
just women, so she can also help them as well because she has a wonderful coach, Joe. Tell them a little bit about Coach Joseph.
Oh, so Coach Joseph is the luckiest man in the world. It's my husband. But he actually joined the practice full time a couple years ago, and he's our male intimacy
Mm-hmm.
coach. And so what he does is he, can talk to the men. I talk to the men. I do the medical component. He helps the men to feel more comfortable because this is a difficult conversation for a lot of men. When you start
Mm-hmm.
talking about hormone replacement therapy, when you start talking about changes in erections and erectile dissatisfaction, it happens just like vaginal dryness does. But he's there to help men along the way as they, improve their sexual health and improve their hormonal health.
Good. And again, just be, just be open with Dr. Mia, let her know what the issues are, and she can most definitely address those. Okay.
Mm.
I do want to say this, ladies. We are giving away three wonderful prizes, but you do need to be present to win. So you've got to stay to the end. Keep those questions coming. If there are questions that you would like to ask Dr. Mia, she's here to answer those. So keep those coming, and we'll get those addressed as many as we can so that we won't keep her long or you. Okay, Dr. Mia, how can women become more proactive advocates for their own health?
Yeah, I mean, I think it requires a little bit of education and research so you can figure out, like, if they tell you have something, going to a reputable site, and making sure you do a little bit of the research on your own, asking questions, taking someone with you when you're, learning about what's going on with you. If it's a new diagnosis, a new chronic disease, taking somebody else to hear with a second ear, writing down your questions before you go so that you can ask the doctor or the provider all of the questions that you need to ask so you get a better understanding of it. Ask your doctor for information. A lot of times we
Mm-hmm.
have information that we can give you that'll explain things better. And I think telling your doctors what you need, and when they don't give you what you need or help solve the problems that you're having, finding another doctor that's going to
Absolutely.
you and that's going to take good care of you, and make sure you're getting the proper screenings and doing the things that you need to do.
Because you, not only your doctor, you have got to be your biggest advocate. Because I'll just use Dr. Mia. She's there to help you, but she can't help you if you're not telling her everything.
Right.
If you know your body, and if you know you're having an issue with your body, you need to make sure Dr. Mia or whomever your gynecologist, board certified gynecologist is, is you're letting them know everything. So you've got to be your biggest advocate, number one. And then number two, make sure you pick someone that you feel is concerned about you. If you go in and you're asking questions and they don't feel like, you feel like they're rushing you and don't really want to answer your questions, and not helping you in the way you feel like you need to be helped, then you need to find someone else.
Right.
So
And
I would
then
say Dr.
remember
Mia
too
count.
now, for one visit, you can't really get everything that's ever
That's
happened in
true.
your life fixed. So you
Mm-hmm.
got to be reasonable with your providers. Your provider gets about a 15-minute visit that your insurance covers. It's actually about 8 minutes. So you can't tell your provider that you have hormone problems, abnormal bleeding, headaches, and think that they're gonna fix all of that on one visit. So we got to be fair to our providers as well, but you may have to have a couple of visits to get everything taken care of. But they should be able to focus on 1 to 2 issues and get those resolved for you, or decide on a treatment plan at that time. And you may have to follow up for.
Very good point, Dr. Mia, because we will go in. I got my notebook and I want to ask A through Z while I'm here with
Right,
this $25
right.
copay.
Okay,
Let
now
me
you
go ahead
I
and get
think
all
you
the
got
questions
two
in.
or three of them.
Oh, not three, Doc. So, ladies, we can't bring three notebooks and try to get all that in
Oh,
in
I'm
15
talking about we
minutes.
can probably address two or 1 to 2 to 3 concerns. Like some doctors will only do one.
Uh huh.
We'll try to catch two of them at least. You know what I mean, on one visit. But yeah, just be fair to your providers and reasonable. Reasonable expectations.
Absolutely. Okay, Doc. So, to wrap this up, and then I'll get a couple more of the questions. Where can listeners find reliable resources for women's health information and support?
So you can go to mebellawellness.com. I have hundreds of blogs on there that talk all about anything you can think of gynecology. So if you go on my website, mebellawellness.com, I mean, it's a blog about why you need pap smears. It's a blog about how to get ready for your gynecology visit. It's a blog
Mm-hmm.
about hormones. It's a blog about sexually transmitted. I mean, anything you can think of that's gynecologic. Follow me on Facebook, Mebella Health and Wellness. I do a masterclass every single month that's free where I discuss different issues. This month we'll be talking about endometriosis. This past month we talked about fibroids and contraception and abnormal bleeding and menopause. So that's a good way to get information,
Mm-hmm.
from an expert. And then also, yeah, I mean, I think online now you have access to so much information. Even like Up to Date has patient information, and some of the sites that we use as physicians, they have the patient information. So I think the information out here is very readily available. But I think I make it easy to understand, and that's why I like the blogs and some of the things that we have on the website, because they'll give you a
And
lot.
they're very, very helpful. So I would definitely say check out some of those blogs because
I need
even if you choose to not go to Dr. Mia, you still have that information available to you. So, Doc, we have a user that just relocated to the area and needs a new OBGYN or
Girl,
a
go
new board
schedule
certified
an
gynecologist.
appointment.
Are you accepting new patients?
Yes, we love new patients and old patients, all patients. Yes, so we are accepting new patients, mebellawellness.com. You can actually schedule online, and you can always call the office during office hours at 205-995-1009. But it's real
One more time, what's that number, Doc?
205-995-1009. You can just Google Dr. Mia, and I promise you I'll come right up. And then, of course, you can go to mebellawellness.com.
That's mebellawellness.com. Now, we have a user that's on the site right now and looking forward to scheduling her first
Yay! I look
appointment.
forward to seeing you. And y'all remember, if I'm in the office, as
Oh,
long as
sorry
I'm in
about
the
that, Doc.
office,
Did it again. Okay.
as
I was
long as I'm in the
excited.
office this year, my goal is to see all of my patients. So if I'm in the office, even if you start with my nurse practitioner, I'm gonna come into the room and I'm gonna, make sure everything is good. And I'm always looking at y'all's charts and stuff, because there is just one of me, and I'm doing as much as I can to see as many people as I can. But yeah, come to me, Bella. We'll take great care of you. We got a great staff. I got a great team. Got two wonderful nurse practitioners that are Me Bella trained and Dr. Mia certified, Valerie and Brittany. And then we have some wonderful MAs. I mean, it's an amazing team that I have. So we try to make your experience totally different. We play music, we play our music.
Mm-hmm.
Everybody's pretty professional, and they're gonna take good care of you. And we're not perfect by
Absolutely.
any means, but we try our best for you to remember the difference in care at Me Bella compared to anywhere else you
And
might.
I do kind of, Doc, want to reiterate that. Doc has some great nurse practitioners. I know sometimes when you go, you definitely, oh, I want to see Dr. Mia. I signed up to see Dr. Mia. But I just want to tell you firsthand, even if at that moment Doc can't be there, she has wonderful nurse practitioners that
Mhm.
will take great care of you. So that's not an issue at all. You're not going to have anyone that's in there that doesn't know what they're doing. Doctor and hire those kind of people, and they will take awesome care of you. And again,
Mhm.
she looks at your charts and makes sure everything is okay. They will email you and let you know what's going on. You can also check your patient portal. All the information is always there,
Mhm.
readily available for you. So, no worries if you're not seeing. I know sometimes we get a little impatient about that, but there's no worries if you're not seeing Doc at that time, because the people that she has there, they're going to take amazing care of you from the front
Mhm.
desk all the way to your, when you're finished with your exam or your pellet or whatever you're having done. So no worries on that. Correct, Doc?
Yes, that's correct. And if it's any different from that, y'all please let me know, because
Absolutely. And she
my
takes
patients
those
know.
surveys and questionnaires
Mhm.
personally. So
And my
make sure.
patients know that to respect my staff, and my staff knows to respect my patients. So I love both just as much. But both of them are very important to me. So I make sure they take good care of y'all, and I make sure that y'all treat them just as nice.
Absolutely. We have another user that said, well, those pellet treatments will definitely help. And I too, I can't say it enough. Again, this is not paid advertisement. I'm just telling you what has saved my life. So, and has made my husband very, 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 very happy. So,
Right. Yeah, I
okay.
do. I do place pellets, but I also get my own pellets. So as long as I've been doing pellets, I've been getting pellets myself. So I will agree that it is definitely life changing.
Absolutely. Let me ask you. Well, let's see. I'm excited to meet her. Oh, my last GYN over 20 years was a sister who was much like Dr. Mia. Sounds like a win-win for me. It will absolutely be a win-win for you. That I can assure you that it's a win-win for you. Doc's going to take great care of you.
Mhm,
And
I
even
love
if you're not, again, if you're not seeing Doc at that time, when you go for the entire Mibel experience, it's going to be great. So whether it's Doc or one of her nurse practitioners, you will be taken great care of. So that's not a worry. Let me do ask you this, Doc. You made a very important point on one of your lives that I was listening to about, and I want to wrap up with that about having a therapist that we, just for our own, because again, this is Women's History Month or Women's Empowerment Month, and you talk about therapists. Tell us about that again, what you were talking about.
So I always say that everybody needs therapy. They just don't always know it. So if you're
Mm-hmm.
walking around here on this earth in 2024, it's a lot going on. And
Mm-hmm.
it's not fair to bombard the people that you love with every single problem that you have.
Mm-hmm.
Therapists are not just there to help you cope with stress and help you deal with stress. There's somebody that you can talk to, talk things out and over with so that you don't feel like, you're burdening somebody else. And they're trying to
Mm-hmm.
help you deal with stress. They're trying to help you cope with stress, and they're trying to listen and help you make your own decisions. So I think therapy is key. I think it's like one of the necessities: water, food, clothes, and shelter. Therapy is up.
Amen, Doc.
You need your
Amen.
therapist because
And
it's
if
hard.
someone is looking for a good therapist, do you recommend them, or do they just kind of need to do a really good Google search and find on their
Well,
own?
I have a list of recommendations for all kinds of doctors, primary care doctors, all the specialists. So we
Okay.
have a going list, and they stay on our list as long as they take good care of my patients. So we do
Okay,
have a
good. So
list
all
of
right. So you
therapists.
can they can get that from you as well.
Work in progress is one of my favorite places to refer to.
Okay,
Work in
good.
progress.
Let me
So
ask you this, Doc. We have a user that started having hot flashes at 49, hadn't had a cycle in 3 to 4 years. Will it come back? I don't know if she's
the
saying will it come
cycle.
back if she has a pellet or just will it come back in general?
So I don't know if she's saying, well, the hot flashes can come and go. So some people
Mm-hmm.
have hot flashes at the beginning and they go away and they never have a hot flash again. But a lot of people would continue to have hot flashes throughout, even after they've completed menopause and they've been out of menopause for 3 or 4 years, they've been postmenopause for 3 or 4 years, they can still have hot flashes. And if you're talking about a cycle, your cycle should not come back. So if you bleed after not bleeding for a whole year and you're in menopause, if you bleed again, you have to let your gynecologist know because
Okay,
that has to be worked up. And sometimes,
absolutely.
with hormone replacement therapy, some women may spot or somebody may have fibroids and they start acting up and bleeding even well after menopause. But if that
Mm-hmm.
happens, if you bleed after 1 year of no cycles, you have to let your doctor know so you can get a thorough workup and make sure that it's nothing going on.
What's the best contraceptive, doctor, for birth control in your opinion?
Well, I think it depends. So if it's somebody that can do estrogen and progesterone, meaning that they haven't had a blood clot, they don't have any heart disease, they don't have uncontrolled high blood pressure. My favorite personally is the NuvaRing. I like the NuvaRing because it's combination birth control. It has estrogen and progesterone. You don't have to remember to take something every day. It goes in vaginally and can stay there for 3 weeks to 30 days. And then I like it too because it helps with skin. So it helps with that adult acne from low testosterone, and you don't have to remember to do something all the time, and you can control your cycles with it. So I like that one, but that's only for somebody who doesn't have high blood pressure, doesn't smoke cigarettes after 35, all those things as well.
Good, good, lady. So remember that, which isn't good for you anyway, still smoking cigarettes. So,
Who does
we don't
that?
want to do that. We have Andrella Woody. She's a kidney health coach. And she says, since it's National Kidney Month, it's important to discuss the need to get tested if you have diabetes and high blood pressure. Can
That's
you
right.
elaborate a little bit on that, Doc?
Yes, so those are part of your normal screening. So just like you see your gynecologist once a year, you should be seeing your primary care doctor once a year, and you should be having your screenings, especially if you have a family history of diabetes. You should be getting your hemoglobin A1C regularly and getting your blood sugar checked, and you should also be getting your blood pressure checked on a regular basis. If it's greater than 125/85, you need to let your doctor know, especially if that's consistent, because you may need medications. And that's right, controlling blood pressure, controlling diabetes, all of those things are going to protect your kidneys and your heart.
Absolutely. So tell us one more time, Doc, how do our listeners contact you, Dr. Mia Cowan?
So go to mebellawellness.com if you want to schedule an appointment, get more information, get some educational information. Go to the website. You can also follow me on Mebella Health and Wellness, and there I give a lot of information as well. So yeah, and or you can call me at 205-995-1009, or just Google Dr. Mia and I'll come up and you can continue to do your research and get valuable information.
And that number one more time, Doc?
205-995-1009. But you can
Two
actually go to the
zero five
website and
nine
schedule
nine
your
five
appointment online.
1009.
But you can schedule right now. You can just go on the
You sure
website
can. You
if
and
you
we
are
just had
interested in
one lady
selling.
that did. So one of our users that did. So please go
And
on
we got the
schedule.
spring fling going on, girl. You know how we do
Okay, what's the spring fling right quick,
our little
Doc?
twice a year specials. We do it for our anniversary in November and we do it in March. So this March we have our consults on sale, our pellets on sale,
You
our
hear that?
intimacy services on sale, our laser hair removal on sale, our weight management on sale. And you know, you always need to use your insurance and come on and get this good gynecology service as well.
Absolutely. I've got to come and get that hair laser removal, Doc.
Yeah,
These
come
little
through.
chin hairs.
I know.
Can't be sexy with chin hairs.
Nah.
So,
Well, you can.
ladies, let's send some hearts and some thumbs up and thank Dr. Mia for coming on and joining us. Yay, Dr.
Thank you
Mia.
for
Thank
having
you.
me. This was awesome,
This
Stephanie. You
was
have a great
amazing.
audience.
We have a great group of women. And again, thank you, ladies. We are actually at over 4,200 sister queens, and we have only been we've only been on for not even quite a year. So we'll be
Wow.
celebrating a year this month. So we're going to have some prizes for the year. We're going to be celebrating our 1 year anniversary. So thank you again to the over 4,200 sister queens that have joined our movement of positivity. We greatly appreciate it. And Dr. Mia, once again, we thank you. Hearts, hearts, ladies. Thumbs
Thank
up to Dr.
you.
Mia. Thank you again, Dr. Mia. I'll go ahead and let you go, and we're going to have some drawings for our. All you need to do. Thanks, Doc. Love
Bye,
you,
y'all.
Doc.
Thank
See you
you.
soon.
Okay.
Okay, ladies, all you need to do is just type me Bella in the chat, and we're going to go ahead and get those drawings started. So once again, me, Bella in the chat, and we're going to give away 3 wonderful prizes. I hope you enjoy Dr. Mia. She is absolutely amazing. And don't forget, hashtag me Bella in the chat. Keep doing it. Hashtag. I'm sorry. I see you seeing the doing the me Bella. Go back. Hashtag me Bella. Hashtag me Bella. Hashtag me Bella. So we can go ahead and get those tallied up and see who our winner is. So if you've just put me Bella and it's hashtag, it's showing hashtag MIBELLA, me Bella, hashtag me Bella in the chat. And let's go ahead and start drawing for some prizes. I'm gonna give you a couple of seconds more to get that hashtag me Bella in. That's hashtag MIBELLA. And we're gonna start drawing for those prizes. I hope you enjoyed Dr. Mia. Again, I can only tell you from that's why I wanted to have her on because she can just really help you when it comes to those hot flashes and night sweats and mood swings because it just really, I will say, it literally saved my life because they were just so horrible. So, lady, give her a shot. You can, hey, if it doesn't work for you, then you'll know. But just give her a try. But hashtag me Bella in the chat, and we're gonna go ahead and start our drawing. And our first giveaway is going to be. We're gonna go ahead and get that up. Okay, our first drawing is for a $25 Amazon gift card. Woo! So again, enter hashtag me Bella in the chat for that $25 Amazon gift card, and we're gonna go ahead and tell you who our winner is. Okay. All right, that little spin the wheel thing isn't working. So do me a favor, ladies. You have the hashtag me bell. I'm going to have to get you to do one more thing because our little wheel thing, for whatever reason, isn't working. So can you put your name by your me bella? Hashtag me bella and your name, and then we'll select from there. We'll have our drawing. Hashtag me bella and your name. Just put your name. Sorry to make you have to go through this technology, I tell you. Technology. And just remember next time on our, when we have our next discussion with our next person that will be on, I want you to go ahead and put your name in StreamYard so that we can find out who you are, because as of right now, we only see Facebook users. So, and we would love to interact and by using your name. So if you could put your name on StreamYard, that would help us out tremendously. Okay. The first person, we've had a drawing, and our winner of our Amazon gift card is Tanya Bishop. Tanya Bishop, you are the winner of our Amazon gift card. Yay! Tanya Bishop. Tanya Bishop, please inbox me and give me your contact information, and I will have that sent right over to you. So, once again, our winner of our $25 gift card is Tanya Bishop. Okay, our next. Hold on one second. So just so I can see your names, I just want to make sure I can see your names, lady. I'm sorry about that. Because again, if you're not putting it into the StreamYard, I can't see your names. So I'm just gonna hop on Sister Queens so that I can see your names. Okay. All right. We are going to have another drawing. And this drawing is going to be for our now, this book right here, I'm telling you, it will transform your life. This book is entitled Worthy, and it's how to believe you are enough and transform your life. It is so good, and it's by Jamie Kern Lima. I mean, she is a New York Times best-selling author, and she is really, really just dynamic. So, we're going to have the drawing for the book entitled Worthy: How to Believe You Are Enough and Transform Your Life. Okay, we're going to go ahead and let him spin the wheel on that side. All right, and the winner of our book Worthy is Dominga Denise. Dominga Denise. That's how you're listed on Facebook, but I'm thinking that's Dominga Smith. So, Dominga, you are the winner of our book Worthy. Yay, Taminga! Yay! Okay. All right. And our last and final drawing will be for a beautiful Sister Queens bag. So I don't know if you've seen one of those or not, but our Sister Queen bags are just phenomenal. And I'm going to have a drawing for that. Okay. So let's go ahead and spin the wheel. Spin the wheel. Let my assistant spin the wheel. All right. And the winner of our Sister Queens bag is, he's spinning the wheel. Okay, the winner of our Sister Queens bag is Monica B. Hardwick. Monica B. Hardwick, you are the winner of our Sister Queens bag. Yay, Monica. Okay, ladies. So, again, our winners are Tanya Bishop. She's the winner of our $25 Amazon card. And then for our book Worthy, we had Dominga Denise, which I think is Dominga Smith. And then for the winner of our Sister Queens bag, we have Monica B. Hardwick. Yay. Thank you so much, ladies, again for joining us for another episode of Let's Talk. And we will be back next week. And our speaker for next week will be Shaquita Pope Maxwell. And Shaquita Pope Maxwell is the founder of J&G, which is Just Networking Girl. Sorry about that. And she is connecting and networking women. So please be sure to listen out for her. She's going to drop some amazing gems as well. And thank you again for joining us for another episode of Let's Talk. And last but not least, ladies, if you haven't gotten your tickets for the Nashville party bus trip, go ahead and do so because they sell out quickly. The deadline is April 15th. Again, the deadline is April 15th for those tickets. We're going to have an amazing time. We can light the party bus up. We have a great time. And then we're going to just turn out Broadway Street in Nashville, Tennessee, having lots of fun. So, ladies, go ahead and get those tickets before they sell out. And we look forward to having some fun on the party bus with you. Again, thank you so very much for joining us for another episode of Let's Talk. And thank you again for over 4,200 sister queens that have joined our movement of positivity. I love you and I greatly appreciate you. Have a good rest of your night. Talk to you soon.